Good morning, everybody. We're now live. Welcome to the Children, Young People and Families Cabinet Panel. I'm Councillor Teresa Heritage. I'm Executive Member for Children, Young People and Families, and I'm the Chair of the meeting today. As usual, I have an announcement to make in relation to COVID-19. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of this meeting are asked to keep their microphones and cameras switched off until called to speak, and to switch their microphones and cameras off once they have finished speaking. To indicate a wish to speak, members should request to do so using the chat function. Okay, so we're using chat, not raise hands today. At the end of the debate on each item of business, there will be a vote. Members should vote using the chat function by indicating for, against, or abstain. I will declare the result after each vote. Officers are in attendance, but will keep their cameras and microphones switched off unless called to speak. And I'll try and incorporate breaks into the meeting as appropriate to allow you to stretch your legs. So I'm not quite sure when, but we'll probably take it at the end of particular items of business, but it is my aim to finish by lunchtime, i.e. 12:30 for me. I have not been membership changes, I have none. However, Karen Hastrick is having IT issues, so may not be able to attend. Apologies, I have none. I'll read out to you the members who are in attendance today, as far as I'm aware, and I'll ask them to sort of introduce themselves as and when they speak. Could I ask, Susan, could you turn your camera off, please? So we'll have Nigel Bell, Susan Brown, Lynn Chesterman, John Graham, Dee Hart, potentially Karen Hastrick, Leslie Greensmythe, Teresa Heritage, Tina Howard, Graham McAndrew, my Vice Chairman, Alan Plancy, Anthony Rowlands and Mark Watkin. So we move now to members' interests. And could I remind members to let us know if they have any pecuniary disclosable interests or declarable interests as we go through the agenda. And then we move to the minutes. So these were the minutes which have been circulated to you of the meeting on the 10th of November. I'll move through each page, and if you could indicate if you have any queries around the minutes, if I may. Okay, so agenda pack page 5, agenda pack page 6, agenda pack page 7, agenda pack page 8. On that page 5.4, we've noted information that will be coming to a future panel in relation to special guardianship orders and kingship orders. Jenny will take that forward. Agenda pack 9, agenda pack page 10, agenda pack page 11, and then agenda pack page 12. So please could you all indicate in chat whether you are in agreement with these minutes, please. I think those have been approved. Thank you very much. Welcome, Nigel. I see that you're now in the meeting. Good, I'm pleased. Okay, so we move on to the next item, public petitions. We have none. And so then we now move to agenda item 3, which is the integrated plan, 2021-22 to 2024-25 for this children, young people and families. And our presenter today is Faisal Mir, who's Assistant Director, Finance and Business Support. Good morning, Faisal.
Good morning, Terry. Good morning, all. So I'll just give a brief introduction, if that's okay, and then happy to answer any questions. So the paper really seeks to do two things, and I won't dwell on the first. So first of all, it gives an overview of the integrated plan process and numbers across the council and gives a bit of background and context. I'm not going to dwell on that. I'll go into that in any detail, but happy to answer any questions that members have. The second thing it does is then it signposts to the relevant section of the integrated plan pack for obviously the children, young people and families portfolio. So what I might do just for a couple of minutes is just walk members, because I know it's a big pack, so it can be difficult to navigate. I might just share my screen and just walk members through just for a couple of minutes.
Yep, that'd be fine. Thank you.
The key changes on that side. So if I share my screen, hopefully that's appearing, Terry and others, but do shout if not.
It is.
And just to orientate members, this is on page 81 of the cabinet pack, and this is almost the best way to drill down to what's changed. So this movement statement, as it's called, in a nutshell, tells you what's changed from the current year. So our current year budget on the portfolio is about 173 million, and what this table shows is has the budget increased or decreased, and a positive number is an increase and a negative is a decrease. So I won't go through every line, but maybe if I draw out the sort of maybe 3 or 4 key changes, and happy to answer any questions on those or anything else really. And it's worth saying that some of these changes were in last year as well. So not all of this is necessarily new. They just represent changes to the current year budget number. But like I say, if I flag the 3 or 4 key changes, then I'll open up for any questions, which I'm happy to take. So the first one to flag, and hopefully I don't know if I now highlight it if this appears, but OP76 is worth flagging in so much as members might recall in last year's IP process, we flagged that we were going to look at the contribution the high needs budget makes to CLA and social care placements. We have reversed that saving out particularly because of the financial pressures that are being seen on the high needs budget, and in discussions with Schools Forum, we didn't think it was appropriate to increase the funding that comes from the high needs block for social care placements. So that's the first one to flag. The next one at the bottom, OP78. So this is an additional pressure on home to school transport, and again members will be well aware of this already, but this increase over the subsequent years really shows the trend of continuing increasing demand for SEN services and for home to school transport. So it's worth flagging that we're continuing to see that demand increase. Again, I'll just talk through them very briefly, but very happy to answer any questions. In terms of the savings side, again, focusing more on the new efficient, and it's worth saying there are no new policies, there are no policy choices in this document at all. So all of these are efficiencies. They're elements which won't impact frontline services. It's worth saying that. And in that context, the 2 key efficiencies that are probably worth flagging is there's an efficiency there of NE 11, which relates to various things. We thought it'd be just too many lines if we split it all out, but just to give a flavour of what's in that. For example, there's some mileage savings in there that we think with future ways of working, and especially in the current situation, that we think we'll be able to deliver across the service. And again, none of that impacts the way we will interact with children and young people, or be it of detriment, but it's just about making efficiencies in it and making improvements to the way we work, for example. And then the last one that's worth flagging right at the bottom, and again, there's not much detail here, but happy to expand on it, is around homeschool transport. One thing we have been doing, and which I think is really a positive thing, is we've been trying to flag the benefits of personal travel budgets to children and young people. So this is where, rather than the council transporting a child or young person, we essentially give a personal travel budget, a sum of money to the family to arrange for their own transport. And there's some real benefits there in the sense of helping prepare children and young people for adulthood, but there also are financial benefits because there's savings to us in the delivery of transport. So so that's entirely, this sort of reflects the increased demand we've seen for personal travel budgets because of that communications we've been issuing to children and young people, and trying to extol the benefits, like I say, particularly around preparing children and young people for adulthood. So in the interest of keeping it brief, that was all I was going to say by way of introduction. It was just to help orientate members around the paper and some of the key changes, if that's sufficient, Terry, but happy to answer any questions. I'll stop sharing my screen for now, just to avoid blockading the screen for colleagues, but happy to answer any questions.
Okay, thank you. So colleagues, do you have any questions? If you do have a question, could I ask you to either refer to the particular line in the spreadsheet, OP whatever, or if it's in relation to narrative, if you could refer to the narrative page within the document, that would be also, so the rest of us can orientate ourselves to find it. I suspect Faisal could dictate the whole thing in his sleep, but the rest of us can't, I should think. So are there any questions, observations, comments? Can you indicate in chat if you have any? Thank you. If you don't, obviously, that's fine, because this has been through scrutiny. So I have Anthony, page 76. Is that in the agenda pack?
Yes, it is, Terry. I'm having trouble with my camera, but you can have it probably sufficient, I hope. It's just
we can hear you.
This may be appropriate to another point, but on the last line of page 76 in the big agenda pack from IP says other key project programs and strategies, and refers to emotional and mental well-being of 0 to 25-year-olds. And I'm assuming that is work that is looking ahead in the almost inevitable upsurge in demand for children and young people mental health support provision. And I just wonder whether, I don't know whether it's appropriate now at this point in this agenda, or later in this agenda, or maybe the next meeting, whether we could have some comment, maybe even a short report on what we're doing to thinking ahead to the aftermath of the pandemic, when all the major mental health organisations predict that we are going to be confronted by a lot of problems revealing themselves amongst young people. Thank you.
Yeah, Anthony, thank you for that very important question. Could you turn your microphone off, because I'm repeating myself? Thank you very much. Yes, that's a really important question. And as I previously said, we are already doing a piece of work looking at the impact of COVID on children and young peoples. And obviously, we are all aware emotional well-being and mental health is one of those major issues. I think, to do it justice, if I might, that we bring that item to the next panel in March. So we can ask officers to give a full and concise account of what's been going on, what's going to go on, etc. Because there's an awful lot going on. Would you be content with that, Anthony?
Terry, thank you very much indeed. I fully accept that reassurance and commitment. Thank you.
Okay, thank you very much. So next I have John Graham, a question about policy. John.
Chairman, thank you. I heard Faisal say, if I heard you correctly, that the budget has no policy changes. I'm not sure whether that's correct, but if that is the case, is this because the budget is there to recover from COVID, and are there things that we might wish to do once we've got over the COVID issues? Thank you.
So it's probably loose use of the phrase for me, John, apologies. But when we talk about policy changes in the IP context, we essentially mean savings that include a reduction or a change to our services. So what I mean is that there's no specific savings in the IP that result in reductions to service. So we sort of use that phrase, and apologies if it wasn't clear, we use that phrase policy changes to refer to a way essentially of delivering savings. But to be clear, where the savings in this document are from are purely from efficiencies, as opposed to any changes or reductions in service.
So, John, you'll recall last year we made a decision to, or was it the year before? I lose track. To invest in the provision of our own residential accommodation. So that was a decision. We had to find funding, etc. So that's a policy change. So that was taken in a previous year. That policy is still there, and that's working through. But we haven't made any because it's always a 4-year plan. Effectively, we're always looking at 4 years. We haven't, I don't believe we've introduced anything that's new in this particular budget. However, saying that, going forward, as a consequence of COVID, we will have to potentially relook at how money has been allocated. So just as a for instance, there might be a really large impact on children and young people's mental health. And we might say, well, we need to change the way we work. And so we might reallocate funding into that particular area. So, for instance, this year, this current year, we implemented a new adolescent offering in SASH, which started in April. So that's where we reallocated funds around the budget to work with adolescents. But if we want to get any additional money in, we'd have to make a special plea to reserves, but there's nothing at this time. Is that all right?
Yeah, no, thank you very much indeed for clarifying it. And I think for me, it's important that we've made that point just to make sure there's no misunderstanding of the words. So thank you very much indeed. That's very helpful.
Okay, thanks, John. I've then got Nigel. Do you want to ask your question? Are you able to, or shall I read it?
Thank you, Chair. Can you hear me?
Yes.
Yeah. Thank you. And can I just ask, I don't know if it's just necessarily for Faisal, but obviously in the contingency fund, it says 5 million, but I just wondered if there was enough to cover that extra spend that may be needed after COVID across all children's services. Thank you.
So yeah, maybe two thoughts there. And so I think if you look at the overview cabinet paper, I think across the council, I think we have made a decision to increase the level of general contingency across the council. So if members look at page 8 of page 22 of the general IP pack, it talks about the general level of contingency we're setting aside, and talks about a general contingency of 13.2 million. So we are setting because of those uncertainties and risks, there is a general contingency pot being set aside across the council. So that's on page 22. And then the other point to make, to provide hopefully some reassurance, is that obviously as part of the spending review, we did also receive additional COVID grant for the coming financial year. And again, sorry to make members jump around, but on page 9, the cabinet paper articulates that a portion of that money, at least 12.5 million, so that's on top of the general contingency, is being set aside for all sort of COVID costs and risks. So hopefully that provides some reassurance, Nigel, that across the council we are trying to be prudent, both in terms of setting aside more general contingency than we would in an ordinary year, so to speak, and also in setting aside some of that COVID grant for unforeseen risks, and in the context for us as a portfolio, if there were risks that were to materialise, it would be one of those two pots that we would draw down on, if that makes sense.
Yeah. So Nigel, obviously we're being very vigilant, and we are starting to accumulate evidence as to what's been going on with children and young people across the county, and that will be an important piece of work going forward. So I can assure you that if we feel we need to ask for some additional funding, we will do. And you know, we are already asking for COVID funding that's come from central government, for instance, to support the delivery of EHCPs, etc., because there's been a high demand there. So,
okay.
Jenny, would you like to say anything on this?
Just to say that we, first of all, as Terry mentioned earlier, we're going to begin a piece of work around analysing data on the impact of children and young people over the last year during the pandemic, and that will help us inform where, as Terry was saying, we'll allocate or move around resources. And as Faisal was saying, the council has allocated some money to assist across the council, not just in children's services. So I feel comfortable that certainly for the next year, we've got that ability to focus on where there's most need. But the really important thing is that we want to ensure that our strategies going forward are informed by evidence, hence doing the data analysis. And we hope to bring an outline and a scope of that to the panel in March. Thank you, Terry.
Thanks, Jenny.
Good,
So
thank you.
Is that okay, Nigel? Thank you.
Yeah, now, thank you. Come back.
And Mark, I hope that covers your comment as well. Is that all right?
Yes, it does, Terry. That's fine. I think that was a very detailed response. Thank you, because it seems to me this particular area is so full of risk at the moment, so many unknowns. So absolutely picking up what Jenny is saying, and pleased to hear that there are various ways of being able to offset that risk. But yes, and just to reinforce, I'm delighted. Well, I go to Forum, I know just how much the pressure on high needs is. So had that cut gone through, it could have been really drastic. So I'm really pleased to see it's come back in again. Thank you.
Yes, thank you. Thanks very much. Okay, so I think there's no more questions. We've covered the IP. Tough year coming. I don't think we're really going to know what's hit us for another 6 months. So please could colleagues vote accordingly in the chat box, for, against, or abstain. Okay, thank you very much. Too many purple boxes, so I'll now vote. Okay, thanks very much indeed, everybody. So that's been approved. I should highlight for audience that listening that there were 2 abstentions. One was Nigel Bell and Mark Watkin. Yeah, Nigel Bell and Mark Watkin abstained. Thank you very much. Everybody else agreed. So we now move on to item 4, which is early years special education needs and disabilities. Now, colleagues, I'm really sorry. There were which I didn't appreciate till I was reading papers yesterday, rereading papers yesterday, I should say, that there were 2 appendices were missed on the internet, and those were appendices 2 and 3. And these have been sent to you in an email this morning. They are the first appendix is just showing the names of the staff that are in the service at the moment, and the second appendices is sort of like an on the page report on what next, in effect. But I'm sure that officers will talk about that this morning. So we have with us today Dina Woolworth, who's specialism lead for early years. Or potentially, or Nikki Youngs, who is a development manager. So, good morning. Who's going to present to us? Is that you, Dina?
Yeah, we're presenting together. So Nikki is starting, and then I will be following. So I'm just going to share our presentation.
Thank you. So Nikki, can we see your face?
I've got my camera on.
Oh, now I can see you. There we go. Great, lovely. Thanks very much. So.
Okay, so
can you, that's it, lovely, yeah. It's big enough now, lovely, great.
Okay, so just a quick run through with early years SEND updates, and this presentation is just to accompany the paper that you've had previously, just to give a sort of bit of background to it. Okay, Dina. So I will cover the early years SEND workstream updates, and then Dina will talk about the SEND specialist advice and support updates. So it's a very quick whistle-stop tour of some of the work that's been undertaken within the early years SEND workstream. So the SEND early years SEND workstream is a subgroup of SEND SLG, but it's got a focus on families with children under 5 who have SEND. There's representation from HPCI, health commissioners and providers, family support services and early years providers. So the purpose of the group is to sort of look at the priorities for work for this group of children and their families. So one of the things that was identified was the need for parents to have a flowchart developed that would clearly illustrate the pathways that their children would follow when they enter the system. So that sounds like a really small piece of work, but it actually took quite a long time to get agreed and tweaked, and to a stage where we're at now, where parents and professionals can access the flowchart to see entry points for children with particular needs. So it outlines the offer to parents based on whether children have an emerging need or whether they have a diagnosis. So that was quite a big piece of work that was undertaken there, and that is now published. And I think you have got it as an appendix to see there too. Another priority identified by the group was the need to establish SEND champions within the family centre service. It was felt that families would go to the family centre with a child who had SEND and not really know where to go and how to access services. So the champions have had training from HPCI and from the SEND SAS service. They are existing members of staff within the family centre service. It isn't an additional role. But they are the first point of contact for parents who come in, and they are then able to signpost to other services that are available and how parents can access those and support them in doing that. And then the final piece of work that I want to talk about is specialist nurseries. This has been going on for a while now, and obviously it has had a little setback in terms of COVID and how we've been able to take the work forward, but there has been a need identified for children who are unable to access their free early educational entitlement because their needs can't be met within a universal provision. So we're looking at setting up initially 3 specialist nurseries for children who have got complex needs. We have identified sites. These are buildings that were previously used for family centre services, but since the reorganisation of the family centre service, they're no longer used as much as they used to be. So we feel that to use them to capacity, this would be a good way to take that forward. So we're looking at Batford Children's Centre site, Allsorts and Bridge Road. So currently we're at a stage where there's detailed feasibility being undertaken to understand the funding implications around that, the cost of the buildings, the cost of staffing, etc., and the number of children that would be required and so forth. Thank you, Dina. And so just looking at our next piece of work, things that we're looking at now, we have got a project manager who is working with us on the specialist nursery task and finish group. So we are really trying to drive that piece of work forward now. There is further training planned for SEND champions with SENSAS, with HPCI, and that's very much in consultation with the families and with the staff to see what it is that they need, where the gaps are and so on. And then in terms of the specialist nurseries, we are currently in the process of doing some draft financial modelling to help us understand, as I said previously, what the financial implications are and whether or not it's going to be a viable offer. Thank you.
So I'm Dina Woolworth and I am the specialism lead for early years for SEND Specialist Advice and Support within ISL, and I'm going to give you a quick update on our SEND SAS early years service after our review and then consultation. So we had a review of the early years service in 2019 and that finished in the October. And then after that, we had a whole service restructure after consultation, and we relaunched our new service in April of last year. And since then, we've been working hard to develop our early years offer. So initially, when I started my role, and we didn't have an early years lead for the early years team, it was run by the 4 area lead teachers. So when I first started, I took the initial focus to look at our current service offer so that we could make a plan about how we could move forward. I also used that in relation to the recommendations from the SEND Early Years Review, which I'll talk a little bit more about in a minute. I also gathered information and feedback from staff, so to look at their perspective of what was working well within the team and what we could develop. And then we worked collaboratively to develop our strategic plan, which you have an overview of as one of your appendices. We then started working on a whole service vision, so that's not just for early years, but that was for the whole of SENSAS, so that we could all make sure that we were working in the same direction. And then, as I said before, we had 4 area lead teachers, which we still do have now. You can see in the leadership structure, which is Appendix 2. We've all been working together as a united senior leadership team so that we can carry forward the strategic direction of the service together throughout the 4 areas of the county. So within the early years SEND review, we had a number of recommendations, and I'll just talk you through how we're moving forward towards those. So the first one was to develop a strategic and operational leadership within the service. So that was the appointment of my role to bring everybody together within our 4 areas of the county to make sure that we had a consistent and equitable offer. We have a number of different roles within our service. We have specialist advisory teachers, we have early years inclusion specialists, which are our specialist teaching assistants, and we have inclusion development officers, and they are our area SENCOs in essence, and they support our private, voluntary and independent nurseries across the county. So we have made the role of the early years inclusion specialist a lot clearer to ensure that they're working across all settings, as we had different practitioners working in different settings before. So now they all work in homes with families, they work in the private sector, they work in maintained nurseries, and they work in nursery schools as well. We have also been developing our mechanism for informal support. So we had feedback from settings that it was a bit more difficult to get informal advice. You had to go through quite a long referral process to be able to get support and advice from our service. So now we're looking at developing a universal and a universal plus offer. So that's children that just have emerging needs or a little bit more than emerging needs in regard to SEND. So that's making our service a bit easier and a bit more accessible for settings and families as well at that very first level. We've also worked on creating specialist areas of interest within our team. So all of our practitioners across the roles have a specialist area. So they are now upskilled in something particular so that they can disseminate that knowledge to the rest of the team, and they can act as a specialist within our team. So we have 4 areas: speech, language, communication and autism, socio-emotional mental health, learning difficulties and complex needs, and family support and partnership working. So within those areas, they've written a development plan and they decide on what kind of training would be beneficial to each of their groups so that they can upskill their own specialist group, but also the rest of the team. And then that provides additional provision for our service users as well. We've also been able to develop specific projects from out of each of those groups as well. So, for example, we are developing our work with family centres so that our work is more united, and that's through the specialist area group of family support and partnership working. We're also developing the content and purpose of report writing. We traditionally write very long reports in the early years service. I think that has always been because it's the children's first at the beginning of their journey in relation to SEND. So we wanted to always have a very accurate assessment and the right advice and guidance. But the feedback that we had from settings and from families is that it needs to be a bit more accessible and it needs to be more focused on the outcomes for the child, so it links with a potential education healthcare plan if it heads in that direction, or just so that it's more measurable and it's smart, so that everybody's working on those particular needs for the child. We've also worked on formalising the process for producing the advice and guidance for education, health and care assessments, and the Educational Psychology Service also provide this advice alongside our specialist advisory teachers. And it did seem that in lots of cases we were duplicating that advice, and where we've had such an influx of EHC assessments, we've had to use our time more wisely. So we've introduced a process where the Educational Psychology Service will take the lead on some advice if it's appropriate for the needs of the child, or if the specialist advisory teachers know the child a bit better and they know their family very well, because we work very closely with children and their families when they're so small, then we will lead on the advice. So it's better use of time and it's better for the needs of the children and the family as well. We have early years specialist development centres, which are specialist preschools for children from the ages of 0 to 3. They come along with their families, and we support the modelling of interventions and specialist equipment so that parents can use them at home, as well as having that peer support in a preschool setting as well. So we are evaluating the purpose of our early years specialist development centres so that we can make improvements for the future. We're also developing a SENSAS early years offer to ensure that we have equity of service across the county. As I said before, it could be a little bit variable in the past, so we're making sure that's much tighter now. We are strengthening our working relationships with outside services, as I said, with family centres and also with health as well. We have changed the age that we support. So we were a 0 to 5 service before the restructure, but we're now supporting children up to the age of 7. So that's up to the end of Key Stage 1 where necessary. So there are some children that need a little bit more support in that really important transition point between early years foundation stage and Key Stage 1. So we're there to support family, setting and children where it's necessary. We also have a stronger focus on impact and demand data, making sure that we have robust systems to measure our data so that we can prove the impact of the work that we're doing with our children and families. It was suggested that we needed to have a guide of early years in the early years SEND review, and that's a little bit of what Nikki said. We've been supporting the early years SEND workstream to develop the flowchart so that families have a better idea of the support they can access in the early years. And we're also working on revising the Sensas early years information on the local offer website, as that was something that was also highlighted in the SEND review. Just a quick link to our Sensas strategy. So through the consultation for the whole of our Sensas service, these key items were identified. And so when you look at Appendix 3, which is the strategic overview, you'll see that each of the areas, these are each of the areas that we're working on, and you can see it in a little bit more detail, the focuses that we have for each of the areas. So this links in with the wider Sensas, but also at a more specific level for our early years service users. Next steps in terms of early years Sensas. We are finalising the Sensas early years offer. It's with stakeholders at the moment for finalisation and approval. We are embedding our vision statement, which we have developed as a whole Sensas service, so that we can communicate that with our service users and with our partners. We're building on impact and demand data analysis. It's something that we're looking at in our monthly senior leadership meetings, so that that can provide information on ways of working going forward. We have inclusion practice statements, which help to measure the impact of our IDO, Inclusion Development Officer, work with our private sector nurseries. It also measures the inclusive practice that our nurseries are giving to all of our children, and we are developing those so that they're online and that we can take the data more easily, and we can show the impact more easily too. We're continuing to develop and embed the specialist areas of interest and the projects that are associated with those. We've also started to identify ways to work with our colleagues in health and in family centres, so that we're focusing on early identification of need from the 9 to 12 month checks and also the 2-year checks, so that we can get in there early and support families and settings where necessary. We are working with Hearts for Learning in their Supporting Smooth Transitions project, and we are identifying reception cohorts with particularly high levels of additional needs, so that we can support transition from the end of the summer term and help them to support their whole class of children rather than focusing on individual children, as we've noticed that there are so many reception cohorts that have high levels of need, and it's very difficult to manage multiple levels of need within one class. So we're aiming to upskill and build confidence in classroom practitioners. And we're also starting to develop online advice and guidance, so that some of the more general information and advice that we give to our service users is online, so that they can access it there as well. We are continuing our joint work with the Educational Psychology Service, as I said, making sure we don't duplicate our work. We have started to create a 3-year development plan of the Early Years Specialist Development Centre and what that's going to look like. In the first year, we're working on the consistency between the different centres. We have started to write a new reporting format, which is based on outcomes, and that is being finalised and will be rolled out and our staff trained on that by the end of the academic year. And we are completing a SENSAS time and motion study, which will map the casework of our practitioners onto our service offer to ensure that we can measure the demand for our service and to ensure that we are giving the right amount of time and advice and guidance to dependent on the needs of the child. We've also developed and implemented key performance indicators for the SENSAS service and outcomes, as well as introducing a survey for feedback for families and also for settings, so that we can measure the impact that we have, the advice and guidance that we give, the impact it has, but also so that we can carry on improving our service from the feedback that we've been given. Thank you very much. I'm not sure if you have any questions.
Yeah. Don't worry, Dina. Thank you very much. That was a very full presentation. Thank you. And I know colleagues do have some questions. Before I bring them in, can I just ask a question, please? I just picked up on that you said your research is showing that reception cohorts have high levels of need. Can you just very, very briefly, because I want to allow enough conversation, explain what sort of need that is? Is that in every reception setting that you've looked at, or is it just in a few? So I think that's quite a sweeping statement, and I need a little bit more evidence around that.
Well, I think anecdotally in our service, we've seen in the last few years there has been a higher level of need in reception. So that's in relation to children with additional needs that could be just SEND support, or it could be children that have an EHCP, those with speech language communication needs as well. Also those that have socio-emotional mental health needs too. But thanks to Hearts for Learning, they have developed a really handy tool, and it's a transition level of need tool. And the settings can fill in the information of the cohort of children that they have currently. So our PVI settings, so they're the private nurseries, and also school nurseries. Then they collate all of the data, and then they can have a snapshot view of all of the needs that are coming into the reception cohorts across the county. So then we can see, by looking at that data, which schools have the highest level of need. So they have a RAG rating system. So red would be the children with the highest level of need, orange would be less, and green would be a universal level.
So that you're saying that's anecdotal at the moment?
That's not, and it was anecdotal in the past, but now we have that. We have some firm data. Okay,
that's a little bit concerning, but however, that's something we're going to have to look at. I have Nigel, then Mark, then Susan. So Nigel.
Thank you, Chair. And yeah, can I thank Nikki and Dina for their very good extensive reports. It all looks very good, and if all this happened and is successful, then clearly we'll it would be a good, I think, improvement and good for our parents with children with SEND. But clearly COVID obviously must have affected this over the last year. I know Nikki kind of mentioned that, but a couple of other questions. I mean, I think it's 25 SEND champions. Are these going to be the key really in communicating and picking up issues across the family centres? And where was the other? Oh yeah, and therefore are they going to be? They obviously have to relate and communicate across the 9 DSPLs, aren't they? Because you did say, I think it was Dina, that sometimes there's not been equity across the county. So will they be not made, but one of their jobs will be to make sure that all the different areas of the county across these 9 DSPLs will be given equal, well, if not equal, but that wherever parents are with a SEND, whether it's in Watford down here or whether it's in North Herts, that they will have an equal chance of getting their child properly helped. That's one of the main things I was concerned about. And I mean, the main thing is, anyway, after all this, with all those, one of the main issues that we get, I'm sure, as counsellors, is parents, whether it's early years or not, having issues over SEND, and it's always been one of the main casework and big problems for us, and obviously with the HCPs as well. So I just hope that with seeing what you've done here and in this paper, that it does mean that we'll have more parents who are more satisfied with the county's offer to their children with SEND. But if you could just look at, and I'm pleased obviously about the HCPR involvement, and hopefully that they're obviously still being involved and encouraged, and that's obviously good. But just looking at the 25 family, the champions, and how they'll liaise across the county. Thank you.
Yeah, Dina. So Dina or Nikki, could you respond to the SEND champions? And then can I ask Joe Fisher to come in and just around how we're managing SEND in general, please?
Sure, Terry.
Yeah, thank you. So Dina, Nikki, about the SEND champions and equity.
So I think the beauty of the SEND champions within the family centre service is that they are in the heart of every community. So that's sort of the first thing to say, that they're very accessible, and one of the main ideas around the SEND champions being within the family centre service was that there is then a consistent offer across the county, so that every parent is able to access to get that support. And yes, one of the roles is to link very closely with DSPL leads across the county as well, to make sure that that sort of linkage is there. Dina, did you have anything else to?
Yeah, also as part of the work that we're doing with our partner services, we are making sure that we meet in our local areas with our SEND champions. So there'll be sharing of information between our teachers within our specialist advisory service, so we understand the pressures of the area as well with the SEND champions, and also they understand our referral route as well. So if they have a parent that they come across that needs some additional support, then they know where our service is and that they can refer in as well. So it's just about linking up all of the services together so we can catch the children early.
Yeah, so that's the essence of it, isn't it? We're trying to deliver early intervention so that we potentially nip things in the bud before they escalate, which we know can happen. Joe, would you just like to comment around general issues?
Sure. I mean, just first of all, to build on what Dina and Nikki have said, in answer to Nigel's question, we are absolutely committed to a consistent offer across the county. And actually what you've heard Dina and Nikki describe is a much more coherent, consistent approach to identification of need early on and the provision of early support. And I think, our aspiration, well, it's more than that. We are confident that parents will get a more coherent and stronger offer through our strengthened early years offer for children with SEND. So thank you both for that. On a broader level, and I recognise absolutely the concerns that Nigel refers to around children with SEND. We are, as you have heard me talk previously, implementing a very significant programme of transforming our SEND system, and a couple of quick highlights from that just to remind members. One is that we're really building on our local provision, so that's both building on our mainstream provision in schools and early years settings, and we from September implemented a new funding framework for our mainstream schools so that they can better meet the needs of children with SEND. And alongside that, our new special school place strategy identifies a commitment to building more specialist provision across the county by 2025. We have also got in place an improvement programme for education healthcare plans and the whole system around that. There's a lot of detail in that, Chair. I won't necessarily go into the detail now, no. But I am again confident that through greater use of digital platforms, we will enhance the transparency of the system as well as the efficiency, so that again parents and carers and children themselves get a much more consistent and strong offer. And we're already beginning to see that happen. We're getting some really good feedback from parents on the initial outcomes of the new programme.
Okay, fine. Thank you very much, Joe. Right, so Mark.
Thank you very much, Terry, and I welcome this absolutely wholeheartedly. I think it is a tremendous enhancement to the service. I really pick up on the fact that you're trying to communicate better and more clearly with families and with schools and indeed, I guess with health providers, I noticed your flow chart, which you took a long time to produce, is absolutely key to helping people find their way through the system. Because picking up what Nigel said, when you talk to families, one of the biggest frustrations is just their confusion. They can't seem to get a common approach from different organisations as to what need they have. I just, first of all, I was hoping to get some idea of the scale of need, and I didn't get that from here. I know, of course, it's there, and I would really like at some point just to get a feel for what is your assessment of the need, and when you're ready, if you can analyse that. I'm not asking it now. I'm just thinking, we need to understand just what the challenge is, because absolutely, the earlier the intervention, the better the opportunity for those children in the future. If we can address their needs before they become too established and ingrained. You mentioned 3 special nurseries. Will these be run by PVIs? Are they going to be run by the county? And indeed, I was approached with another county councillor from a provider in Watford who was keen to set up just this sort of establishment, and just to a certain extent being kicked back. So it may be that their approach wasn't right, but I think they sense that there's a real need in this part of the county. So I'd be interested to know, if there's scope for others to come in and willingly and be welcomed in. This was about 18 months ago, so it wasn't that long ago that we had this discussion. And I think those are really the key points. More data when you can achieve it, and what are your targets? What are your KPIs? I know this is very number oriented, but there's a lot of quality here. But I'd like a bit more firm facts at some point. And then those 3 nurseries, are they going to be? You mentioned 3 places. I didn't know where they were. I'm sorry, they were just names to me. Are they deliberately placed around the county so that they are approached by families? Because of course, a nursery, a young child, you can't drive 10 miles with your young baby to get them to a nursery. It isn't going to happen. So they're going to be focused on a very small group, a community, a relatively local community. Sorry, that's quite a bit of stuff, but I'm supportive. I just want to see a bit more information behind it. Thank you.
Okay, who's going to respond, Nikki or Dina? Nikki?
Yeah, I mean, I think in terms of the specialist nurseries, we're looking at a sort of we're looking at the options at the moment. We do have a task and finish group that's looking at the detail here. And one of the things that we're thinking is that it may be a commission service. So we would be looking for expressions of interest to run that service, be it via existing maintained provision, either special schools or maintained nurseries that may be interested in doing that, or we may look wider. We're just sort of working through that at the moment. In terms of locality, we have tried to go for a spread across the county. So one is Harpenden, one is Stevenage, one is Broxbourne, and I know that not every parent with a nursery age child would be able to access those at this moment in time, but we're looking at how successful they would be, the cost of running them, and whether or not it is feasible to sort of broaden that out from there. So it's a trial at the moment, but something that if we can afford to, then we would look at expanding.
So Nikki, just on that, what's your timeline for scoping out the requirement?
So we're in the scoping process at the moment. So
when is it due to end and make a decision? I haven't got your timetable in front of me.
Right. Okay. So we're looking at the provision being open in 22, if all goes according to plan, September 22. So working backwards from there.
Okay. So we're looking at some sort of decision making towards autumn, late summer, autumn.
Yeah.
I can get that. Okay, fine, thank you. And in relation to evidence, do you want Joe to come in, or are you able to talk about how you're gathering evidence and how members can see the evidence?
So the evidence of need for the nurseries?
Well, the evidence of need general, across early years SEND.
Yeah, Dina, do you want to pick up or?
Yeah, so we, as I said, we have our the KPI work that we're doing, which once we have that in place and it's up and running,
so
then that will
it's not
be
there yet.
shared.
Jo, do you want to come in?
Yeah, it's written, but we need to gather the evidence because it's new. In relation to demand, we have our data within Sensas, but I know within ISL we collect data as well from our main shared services. But I don't know if, Jo, you want to add some more to that.
Just to add, Chair, that we are actually bringing our SEND dashboard with our key KPIs and performance data to the next panel, I think in March. What I'll do is I'll have a look at it. I'm not sure because, as Dean has said, the development of our early years KPIs is still very much in development, but we can have a look and see what data we've got there that would be relevant and try and build that in if that would help, Chair.
Yeah, that would be really useful. So thank you very much for that. So more coming in March, guys. So that's really, really useful. And then finally, I have Susan's questions already been answered. And so
sorry, Terry, can I just come back a second, if I may?
Okay.
Briefly. I mean, my first question is I mean, I have an operator who's interested in running a school.
So Mark, can we take that one offline?
Well,
so there will be a commissioning process, as you know. When we've scoped out, then we go out to the market.
I just want to tell them what they can do. Okay, I will.
Yeah, no. So they'll have to watch our usual procurement methods, and that's why I was trying to get some timing for you. So I suspect that we will get that late summer, early autumn. But as officers do the work on the scoping, you'll be able to get updated. So, but in March you might have a better understanding. Jo might be able to bring that back in March.
As to the KPIs and the date coming in March, that's great. Thank you so much.
Okay, thanks. So Dee.
Thank you. Well, my first question's been answered about where were the specialist nurseries located. So thank you for that. A quick question regarding the voice of stakeholders. I think this is really important going forward. And I see that you've got a close date of the end of this month. How is that progressing at the moment, please?
Our surveys have both been created. They've been and they've all been approved, so they're ready to share. I think we send them out biannually for parents and also termly for settings. So in terms of settings, so schools and private nurseries, we send out the feedback surveys at the end of the term, and then they give feedback on any of the cases that have been closed during that term. So if the period of intervention has finished and we've closed our service, then they can give us feedback on each of the children that we've supported.
Okay, so you get basically you're looking at it termly.
Yes, essentially.
Okay, great. Okay, thanks. Susan, you're coming back. Susan?
Yes, it's sorry, it's a comment rather than a question because all my questions have been answered. I'd just like to say thank you for your presentation and all the work that you're doing. And like many councillors, you know, we have a lot of questions about SEND. And I think this is a really wonderful idea, the SEND Champions, and I look forward to hearing how the service is used. So thank you.
Yes, I think the main issue around this particular area is making sure that parents and families know that there are the SEND champions within the family centre service. So that's going to be key, isn't it? Communication, as ever, communication. But I believe that we've improved in that over the last couple of years, and I'm hearing from HPCI, etc., that is the case as well. So thank you very much, Nikki and Dina. That's been really, really useful. And I suspect we'll ask you to come back probably next year to give an update as to where you are and what's happened to the service over the year. So thanks very much indeed for your input. Really good.
Thank you.
Thank you. So colleagues, moving on. Do we need to vote to note it? Michelle, do you want us to vote?
Yes, please,
okay.
Teresa.
Sorry, I need to ask you. Can we all agree that we've noted and commented accordingly? Can I just say, put agree in or disagree or whatever. hopefully we're all happy. Excellent, thank you very much indeed, that's great. We'll now move on to the next item, which is elective home education. And our presenter today on this is Richard Woodard, who's the county lead for access and inclusion. Good morning, Richard.
Morning, Teresa. Morning, everybody. I'll just give a brief summary of the paper that that you've all received. So the numbers of electively home educated children and families has been increasing significantly, both across Hertfordshire and nationally. In relation to Hertfordshire, in the autumn term of 2020, we received 215 more notifications than we did in 2019 in the same period. Parents and families highlight the main reason for choosing elective home education as dissatisfaction with the school system. The actual highest number is no reason provided, but I'll put some context into that. We're finding that lots of families have little idea of what elective home education entails, and then often approaching the local authority asking for extra support and help. But it's too late really once that decision has already been made, and we have to divert them back through the admission process. All parents have a legal duty to educate their children, and home education is a recognised form and suitable education. However, home education can look very different from what school education can look like. The local authority does not have any powers to routinely monitor home education, but it has a duty to establish instances where suitable education is not being provided. And that means that we go back to the families asking for evidence of progress and outcomes. In relation to COVID, we provided an online survey to elective home education families during November 2019. We got a really good response from those families. I'd like to thank them for the information they provided. And however, decisions to home educated, the majority had seemed to have made that decision before coronavirus. However, it was clear from that trend that they felt with the closure of schools that these families were in a much better position to continue to provide the education they were already providing. This followed a commissioned research project from University of Hertfordshire that investigated reasons why families choose home education in Hertfordshire. And in order to be seen as acting proactively, I took a paper to Schools Forum in January where funding was agreed for 2 new posts in the small elective home education team, which will allow the local authority to perform their duty in line with current government expectations and the latest guidance, which strongly recommends the local authority meet with the family and the school prior to home education being chosen. And we hope to have these positions in place by May, really, and working out in the communities. There is a potential to expand those roles again later on in 2020 if we can evidence the impact of the work they're having. So overall, we are seeing an increase in the number of children and families choosing elective home education. We are looking to expand the team. The team only consists of 1.2 full-time equivalent staff for the whole authority, and a manager there that has other responsibilities. And then with the 2 new positions, looking to build some relationships with elective home education groups and really be able to support families and children when they make the decision to home educate. Is that okay, Teresa?
Yeah, that's fine. Thank you, Richard. Could you just elaborate, please, on in the survey quote other? or no comment? Because I think 700 odd is quite a large number.
Yeah. So this is part of our informal inquiries. Parents don't have to provide a reason why they're choosing. So the no reason provided is a choice taken by the families, and we follow the DFE Department for Education guidance on reasons why.
Okay, so if we have more staff, we might be able to follow up on that a little bit.
Yeah, and we'd like to drill down. I mean, I had a conversation with a parent last night following this paper, saying that, you know, they didn't feel very supported, and we're hoping these decisions can then be made, but then 2 new posts can also work and build, remove some of the barriers and provide for the families to give them every support going.
Okay, so it's interesting, isn't it? So the parents are responsible, but they're still looking for us to give the support. So that's a challenge for us at the best of times. Okay, so thank you. So I have Nigel Bell first. Nigel.
Thank you, Chair, and thanks for the report. And obviously, because of COVID, we would have expected this to go up. And obviously, I presume it's and it does seem as if it's mainly due to concerns, though, about the school's education. And we hope that it would largely get back to, in quotes, normal, I suppose, after COVID. But on the primary send, it shows 50, the most cases, 55 out with EHC plans. I mean, what are we able to do extra to help those with send who are now homeschooling? We've just had the item on send for very young people, but what can we do on making sure that their help is followed up there? But are we largely, you know, confident that after the pandemic, whenever it does finally over and we get schools full-time back, that most of these will now go back to full-time schooling?
Richard?
Yeah, I can answer the first question. So children with an education healthcare plan that are electively home educated are entitled to receive an annual review yearly, as they would if the child was in either a special school or a mainstream school. If a child has a education healthcare plan as in a special school and the family wish to home educate, the local authority have to support there and make the decision in the best interests of the child and family in that way. So through the annual review process, we'll be monitoring the progress of the children with SEND that are EHE. And the second question, Nigel, around returning to school. Yeah, we're unable to answer that at the moment. We would assume that some would, some may not, but we'll be able to look at data once compulsory schooling returns after this lockdown, and perhaps this time next year.
Yeah, so I would just comment on that if I could.
Yeah.
I mean, some of the issues, if you notice in the survey, around anxiety, not the appropriate support for special emotional needs, etc. But we have got a programme of now building up the number of school places we have for these specific identified emotional and mental health conditions. So I'm hopeful that once we can start introducing those additional school places, parents will feel more confident that they have the right setting for their child. So I'm hoping that, apart from COVID, because I'm aware of people that are keeping their children off school because they're grandparents in the home, for instance, and they don't want infection. So I'm hoping that will work. But I'm also hoping that our programme of additional school places will also help on that. So I think we're doing multiple things, but we're just going to have to watch this one. It's always been a bit of a tricky issue, but as it has been increasing. So is that all right, Nigel?
Yeah, okay. And as you say, monitor it.
Oh yeah, we've got to monitor it. And that's why we've got Richard.
How many come back?
Yeah, Richard's done some excellent work. He's actually sort of gone back to ground zero, as it were, and worked up and got all the evidence for us. And that also informed the type of schooling that we needed going forward. So thank you for that. So I've then got Leslie.
Thank you very much for the report. I just wondered how the children are actually monitored and they're supervised while they're at home to make sure they're getting what they should be getting.
Okay, so that's the conundrum with elective home education, that the local authority has no duty to monitor the children at home. Parents do not have to provide the national curriculum, for example, school hours, assessment, just a few of the points they don't have to have. And there's no Ofsted for elective home educated families. Okay, at the moment, because children are being homeschooled through remote education, the schools monitor engagement in that way as long as the child's on a school roll. So again, this paper comes at a time which makes it a bit more confusing, because homeschooling is different from elective home education.
Yeah.
Okay, so we don't have a duty to monitor electively home educated families. However, if it's raised that there's doubts that a suitable education is being provided, we can ask the elective home educated family to provide us evidence on progress and outcomes for their child.
All right, thank you.
Okay. Yeah, so there's this difference between elective and homeschooling because of COVID. So I think that's, as you said, that's the conundrum, isn't it?
Yeah.
Anthony.
Thank you, Terry, and thank you, Richard, for the report and also the succinct introduction. I mean, as it's hinted, Richard just used the word conundrum. I mean, there are conundra here, and there are also very profound issues around this. And I mean, you just look through the report and see the sort of slightly diffident approach that perhaps government has taken over the years to homeschooling. I did a couple of questions and another comment. I'd be interested to know what what was the general response of the schools forum when you took this report to it earlier last month. There are clearly big consequences, not just for individuals but also for schools, if you've got children who have moved into elected home education and then moved back. You've got all the adjustment issues. There's also, and looking at what the expectation is, and the expectation comes from government in terms of increasing the amount of contact with the parents, and I assume therefore the children, that has capacity issues, and obviously that's at the core of your report, saying that you need more staff. And I'm that clearly is important and valuable, but I'm just looking at this and thinking in terms of these being complex domestic situations, often where those meetings will be difficult and time consuming. I suppose I also, sort of following on my earlier comment about concern about the impact of being at home on young people's mental health, and again this is another cohort, and I sort of the one element where I just sense we wouldn't say we were playing catch up, but clearly this trend has been apparent. If you look at the figures, 2018 to December 2018 to December 2019, which in 8.1, that was already going up 1374 to 1518. So it's a trend that has been underway prior to COVID as well. And so I think we're absolutely right to be considering this really important. I think you look at the numbers, this is not a small cohort. This is now quite a large cohort. So a couple of questions in there, but also a couple of comments. Thank you, Terry.
Richard?
Okay. Yes, thanks, Anthony. So the Schools Forum report was well received. Mark Watkin was actually in Schools Forum. I don't know if Terry Duris is in the call. Yes, schools also demonstrated the concerns that you just highlighted there, Anthony, around the returning children to school and gaps in knowledge of the national curriculum and areas like that. It's also important to note that there are lots of successes and well-established home education networks across Hertfordshire, which allow the children to socialise and gain that aspect of development as well. There's a strong tradition of home education in the UK, where children go on to work and university, for example. So we also have to recognise that. But Schools Forum are supportive. They see the benefit of extra capacity, one in trying to support children and families to stay in school, but also supporting children and families to come back into education if they wish to do that.
Okay, so Anthony, I think in relation to the trend, yes, we had seen the trend moving, and that's why we've done the pieces of work that sort of have concluded around now with this report, and the introduction of those school places for those children with those emotional and mental health issues, because that's, I think, I don't know, but I don't know if officers of Joe or Jenny want to say anything on this, but I suspect that we could track a number of children not perhaps accessing school to the number of children where there's been increased emotional and mental health needs. So, I mean, I think that's an issue, and it runs beside each other, hence all the work that we've been doing. So, Joe, did you want to say anything?
Sure, I'm just trying to turn on my video. Apologies, I'm having a couple of...
No, don't worry.
Hopefully you can see me. Yeah, well, just on the identification of children with social emotional difficulties who might not be fully accessing school. I mean, we do have data on children who are, for example, supported through our ESMA service that Richard manages, that provides a sort of dedicated teaching resource to children who are out of school for medical reasons, including mental health and emotional well-being ones. So we do have some data on that, and certainly, you know, what we have seen is you know, some level of increase in social and emotional well-being issues across all children, not just those with SEND. And our youth survey during the COVID-19 pandemic, part of the pandemic over the summer, you know, certainly young people identified mental health and emotional well-being as a key issue for them. So I think, you know, it's certainly an issue that's at the top of our agenda, and at the top of the school's agenda and young people and families' agendas too, and one that we need to continue to pay close attention to.
Yeah, thank you. So just to highlight to colleagues that this week is Children's Mental Health Week, and I think next week is Children's Mental. Oh, Anthony, can you turn your, yeah, and next week is Children's Wellbeing Week. So there's things going on in schools, and there is quite a lot of places that young people can go to which are web-based. But as I said, we will come back to that at the March panel, which actually isn't very far away now. So we will come back to that. Tina, thank you.
Thank you, Chair. I've got a question regarding the section 437. I wonder, have any notices ever been served on anybody in Hertfordshire about not providing sufficient education? And the other thing is, have you got any feedback on the number of parents who have decided to home educate their children because they've been told that they actually have SEN problems within the school? Thank you.
Richard?
Yes, there are. Yeah, sorry. There are cases where elective home education is deemed unsuitable, and further investigations are carried out by the officer that we have. Often enough evidence is provided afterwards, after that initial informal inquiry. But yes, there are cases where that does happen, and school attendance orders are issued in order to provide suitable education for children. I think it's fairly low numbers, but there are examples. If you want the actual figures, I can get those for you. I don't know them off the top of my head, but they're low. But it does happen. And if a parent contacts us or the family saying that the school have prompted and promoted elective home education, then conversations with the head teacher, chair of governors, and or Ofsted can take place and have taken place. In normal times, I have attended 5 Ofsted school inspections where they've had concerns around what's known as off-rolling and the number of children that have chosen elective home education. So again, Ofsted question the school around that, as do Hertfordshire.
Okay, thank you. Mark.
Thank you, Terry, and thank you, Richard. And yes, as you say, I was at Schools Forum. Just a couple of comments, if I may. This has always been an area of deep concern because you only know what you know, and there's an awful lot of people out there who are educating their children either because they just have despaired with the education system, or they just aren't, their children haven't been accommodated by the schools. And your comment to off-rolling, that's a term I think hadn't heard used until recently, but it's one that used to be used quite a lot about schools. So I'm really glad that it's being picked up. And the other comment to make is that there used to be quite an interesting yardstick of the failings at that point in the SEND service to meet the needs of families, and families more out of despair than out of a positive nature, withdrawing their children because they felt they weren't getting support. On a positive note, absolutely, enlightened parents can do brilliant things with very bright children. So there has to be scope for this, but I worry about the lack of ability of the local authority to supervise. I have one just very simple question, really. Well, two. Well, one's a comment, one's a question. Children being withdrawn now because parents concerned about COVID, do they immediately become ELE, or can they in a sense be put in suspense? Because I imagine most of those parents are expecting once the storm has passed that they can return to the school where their child was before. But if they become ELE, sorry about my throat here, they could well find that those spaces are no longer available. Some of the schools are very popular, and people have expressed an interest to get in there. And if the child's left the school, that place will be reoffered very quickly. And the other one is more of a sort of trend thing. Do parents tend to withdraw children early on and then educate them through life, pardon me, as ELE, or do they sort of come in and out? I was trying to make sense of your analysis figures, and I couldn't make up my mind whether what we saw was a cohort going through or people dropping in and out. So sorry about all that, but I hope you got the sense of what I was trying to say.
Yeah, no, absolutely. So during this lockdown, if any notifications of elective home education come into the local authority, we also are using other members of the Access and Inclusion team to contact the families to clarify, as I mentioned in the last answer, about around homeschooling and elective home education, to do that piece of work. Of course, you're right, Mark, if the child comes off of the school roll, and then the parent, when the lockdown is removed, wants them to go back to school, they'd have to go through the admission process, and that may mean a different school. So just confirming those details. So those conversations are attempted and do take place. High number of children are withdrawn in Key Stage 4 in the older years. There is a group of electively home educated children that haven't been into school, but the dropout rates are highest in Key Stage 4.
Okay, so Mark, you also commented on there was a sweeping comment there about the LA not actually providing the appropriate support for SEN. I hope that with the recent changes that we've made in relation to the types of school places that we offer and the increased focus on SEN, that's just a historical concern. I know that some parents are still concerned about the delivery of the EHCs, but in general, I believe that those areas are improving, and there's a lot of support given to schools in that particular area. Jo, could I ask you to comment on that, please?
Absolutely, Chair. Yeah, I mean, just to confirm what you said, we've put in, I mentioned earlier in the meeting, we've put in a huge transformation programme that's really built, in particular, our support for mainstream schools with a new funding framework that sets out very clearly identification of need, the level of funding and provision that should go against that so that we can better support children with SEND in our mainstream schools. And I'm in frequent contact with many of our head teachers, and the feedback we're getting about the new system is that it is making a difference. So, you know, we certainly don't want to see children being withdrawn from schools because they have SEND, and it is worth noting that the numbers of children who are electively home educated, who have got education and healthcare plans, is very low. I think it's about 4.6% of the overall cohort of elective home education children. That said, you know, there's always more we can do, and we continue to work really hard to make sure that where children are being electively home educated and the parents are raising concerns about school provision to meet their child's needs, we work very closely with them to address that.
Yeah, thank you. And just
Terry, just quickly, if I alluded to the fact that it was a current issue, I wasn't meaning to do that. I was saying historically I used to get a lot of that. I'm getting far less. Jo will know that I'm massively supportive of what is going on under her control in the area, and I think you know, I could spend 10 minutes saying why I think it's so much better now than it was. So I absolutely understand where Jo's going at all levels. So yeah, that wasn't what I meant to say about the current things, but it's still, I have parents who are still contacting me saying that the county doesn't understand their needs. So there's always work to be done.
Yeah, I mean, I think every parent will say that because they're concerned about their child, and we quite accept that. And I can assure you that my focus has been on support for families with EHCPs and SEN. So yes, well, I can say thank you for your comment, and I can assure you that I am particularly focused in that area. But the service has improved immensely. Nothing's ever perfect, but in life is it? But I can say that we hopefully we are being as supportive as we possibly can. So I've got Dee, then Susan. Dee, please.
Thank you. My question is, children that have got elective being home educated, do we keep numbers that how many go on to attend college or university, and do we collect the data regarding the grades or exam qualifications that they actually attain? Thank you.
Okay, we don't collect the grades or the qualifications that the children gain, because it's not in our remit to do that. And then in year 11, or when the child's in the equivalent of year 11, age 15 to 16, each of the elective home educated children at that in that age group is offered a YC Hearts. Sorry, I was just trying to remember the terminology. YC Hearts meeting and support around next steps through a letter, door knocks, and again, this lockdown has allowed us to start that process earlier this year in contacting those families than it does in previous years. Usually it's around April, May time, but we've started that in January, February time, the contacts with those families for next steps, as it's going to be difficult, isn't it?
Yeah, thank you, Richard. So just remind colleagues that YC Hertfordshire do an immense amount of work on following up with young people what their destination is after school, as it were, and they do follow up, and that's why historically our NEET numbers have been lower than national figures. I can't recall what they are at the moment, but it is a challenge. But we've always prided ourselves that we do follow up with young people and help them through finding sort of the next step in life, next step of education or a job or an apprenticeship.
Can I, please, Chair, if I may? Can I
yes.
follow up that question, please?
Yes.
And I'm interested on regarding table 3, and it gives reasons and numbers of pupils and the reasons that they've actually gone for elective home education. And I'm interested in the one regarding bullying. And we've got approximately 100 pupils that are being electively home educated because of bullying. Do we actually drill down a little bit deeper to find out what the bullying issues are? And do we actually try to integrate more with the parents, if you like, to try to resolve these problems with the schools going forward?
Richard?
We don't have the capacity to work with the families around that, but if a number of notifications or applications for EHE come through from one particular school, then yes, we would begin looking at if they all come through as bullying, we would highlight that to the school effectiveness advisor, and take it that way, that there's obviously some sort of problem or perceived problem in that school to look at.
Okay, Joe.
Sorry, I couldn't get off mute. Yeah, no, just to add, I mean, I know that Richard's team, when somebody asks to be to electively home educate their child and the school gets in contact with Richard's team, we do of course have that discussion. And I am aware of a number of cases where, you know, we've really talked to the school and the parents around their reasons and thought about different strategies, and indeed involved some of our advisory teachers at times going into the schools to try and resolve issues. But as Richard says, at the end of the day, if a parent wants to electively home educate their child, it is their choice and they can do that. But it's not that we don't provide support. If we're aware that the reason they're choosing to electively home educate their child is because they don't feel the school's meeting their needs, we do get involved to that extent to see if we can resolve the issues informally. But that's not just through the elective home education team. That would be a broader sort of education and support response across both ISL and Hearts for Learning.
Yeah. So I suppose very often the child who contends that he or she's being bullied, there's often an underlying reason, anxiety, you know, whatever as well.
Absolutely. Yeah.
Yeah. Okay. Is that all right, Dee?
Yes, thank you, Chair.
Good, thank you. And then Susan, please.
My question was about bullying, and it has been answered, but I'd still like to say that I was quite saddened by the numbers, and I don't feel that parents choose to homeschool a child that's being bullied. I feel that it's a need, and I did wonder if, you know, are there extra pieces of work to integrate that child back into school or another school? But I think you've kind of answered it, really.
Okay. So
Thank you.
We do have a strong bullying policy across the county, don't we, that we work with schools with? But go, Richard, go on.
Yeah. So if when a child or a family state that they would like their son or daughter to return to school, that information is gathered by the admissions team for a place back in the school, and then we have in each area an inclusion panel run by my team, and sometimes the elective home educated family may be invited to that panel to ensure that the right support's in place for the new school or return to school. That could be outreach support, as well as passing that information onto the school around strategies and intervention that would benefit all parties to make the transition back into school successful.
Okay, is that all right, Susan?
Yeah, thanks.
Okay, fine. Well, thank you very much, colleagues. So I think we've come to the end of the conversation. So we now need to vote on noting and discussing, and I think we've done that, but can I just have your affirmation that we have noted and discussed appropriately, please? Okay. Thank you very much. I think that's all noted. Thank you very much indeed. So we're now, thank you very much, Richard. We're now at 11:08. I'm going to suggest we have a short break and resume at 11:15 on the dot, and at which time we will have the presentation of the head of the virtual school, Felicity Evans. So colleagues, back here at 11:15, please. Well, for 11:15 to start. Thanks very much.
personal
Oh
information.
dear. So thank you very much, everybody. Welcome back. Yes, Felicity was just sharing the success of the vaccination process. So that's excellent news. Very pleased. But I thought that she was sort of due in the October or something, you know, not yet. So there we go.
Being kind, but that's, thank you. I'll accept that.
So, right, so welcome, Felicity. So Felicity is the virtual school head, and she's here to present to colleagues her annual report. So Felicity, over to you.
Thank you. Colleagues, you will know that I have provided a very detailed report, but actually much more detailed appendices. I've prepared a presentation, a PowerPoint presentation, to go over the salient points. Chair, is it all right if I share that?
Fine. Yes,
and
thank
can
you.
I just check, you didn't want me to do the 30-second Hearts Awards advertisement? I'll try and gloss over that quickly, you know, so I can go over that slide.
Yeah.
But I will urge colleagues to, you will have received it anyway, please look at it, because I think you'll find it extremely uplifting. So I'm going to try and share the presentation now. All right. Now, can colleagues all see that? Yes.
You'll have to make the screen larger.
Yes, I'm going to do that now. Right. Hopefully colleagues can all see that. Good morning, everyone. I'm Felicity Evans, the Virtual School Head for Hertfordshire. And this is a brief presentation to go over the salient points of my overarching report. So I think without being too crass about it, this actually has been a year of two halves if we're looking at education. So the report dwells on what we had intended to do up until March 2020 and what we then had to do subsequently. Now, this report is a little bit out of sync with our life today because I am reporting on last academic year. By some anomaly, my report has been pushed on to this date for the last few years. And that was because the statistical first release from the Department of Education comes out at the end of March, which would usually confirm the assessment data for children taking their end of key stage tests. So please remember that, you know, but I will provide an update on what we've been doing both last term and to date in the final slides of this presentation to ensure members know what we've been up to subsequently. So as you will see from the report, up until March, we were working towards some very satisfying results for our Key Stage 2, not least in mathematics, which had been an area that we had been working on. We have been very fortunate that the What Works unit, the national unit, has offered us the opportunity for some discrete tuition for our Year 6 pupils, which will look at the strategies that schools can use to promote progress for children looked after. What they've done is look at the Education Endowment Foundation research to determine what works best for children in the care system. And we are part of that research project. Of course, matters are in hiatus at the moment, but I expect once we get back to a more usual way of working, that we can work very successfully for our Year 6 children at the end of primary school, particularly on maths. And there has been other reports published quite recently, that maths is going to be the big shortfall for young people because of the incremental nature of the learning. So, of course, we will be developing our strategies alongside that information. For secondary, up until March, we were tracking our young people. We had had 5 successive years of improvement, and we were going for our next one. Unfortunately, as you all know, we are unable to determine the outcomes because these levels of attainment weren't able to be published. However, as we know, young people were awarded GCSE passes based on teacher assessment, and we were able to work with designated teachers and examination officers in schools to support them with information that we had on young people, and to ensure that the assessments that would get offered to Ofqual were commensurate with the ability of our young people. We know the trajectory generally for children looked after is that once they have their mock exams about this time of year, they put on a spurt and actually achieve far better than the assessment at this point in time would indicate. And we had those significant discussions with schools about our cohort of year 11 last year. For our higher education, we have got some very interesting outcomes. We had 12 graduates from university last summer. Surprisingly, they have all, well, not surprisingly, because they're all good students, but they all have gone into very good jobs, despite the decline in employment opportunities. And I'm very pleased about that for those young people. And we see this area of work, the fact that the Hertfordshire Virtual School is an all-through school, so we can track the progress of young people and intervene when they're ready to receive our support, as being very significant. We had 25 young people start this autumn, last autumn I should say, and 4 of whom postgraduate, and one who I'm really very proud of is studying for his PhD. He's our first PhD student. He's studying computational neuroscience. He is having his work published because he's working in the health sector on, I'm going to forget what it is now, tuberculosis. He's working on the cell walls that contribute to being ill through tuberculosis. This young man started out his secondary school career in one of our special schools for social, emotional and behavioural difficulties. And so I'm intensely proud of his work, and he will actually be speaking for me at the next designated teacher conference, because he feels he's got a lot that designated teachers should listen to about support, belief, trust and potential. We have the only, you've probably heard me say this before, the only higher education coordinator in our virtual school, and I attribute her endeavour to the numbers that we have going to university, but much more importantly, staying there and graduating. And there is a link there that I would urge colleagues and members to look at. We have a short film on our website of 5 university graduates, which was aired at the last Hearts Awards, not last autumn, the autumn before, and I used strategically to support and encourage others to work with our young people in an inclusive and enthusiastic way. They've got a lot to say, and I just couldn't be more pleased with the outcomes that we're experiencing, but of course we can always do better. Attendance, as you know, was very good until March 2020. We always have very high attendance in the care system. We've seemed to have approached the battle for taking holidays in term time with gusto, and have really got some good results there. Not appropriate. We monitored attendance and exclusion robustly during lockdown, and I was an early adopter of a very clear message that children, because they were able to go into school as vulnerable, as part of the vulnerable group, that they should be there, because actually school's not just about teaching and learning, it is about socialisation, it's about routine, it's about being in a safe place, and it's about seeing friends. So we ensured that we gave very clear advice to both social workers and foster carers, agreed with, of course, by senior management, throughout the first lockdown, to provide the guidance that I believed was necessary. There was one permanent exclusion that we overturned, working with the school and the school governing body. We have a track record of supporting schools and young people who are threatened with permanent exclusion. And I'm pleased to say that the peer review that was held in February gave some very positive comments about the work of the virtual school and how we approach exclusion. And yes, so I've referenced that in the report for colleagues to look at. We had we're able to put on the Aim Higher events. We weren't able to do them as normal, taking young people off to Wales as we would normally, nor indeed to university campuses for these events, but they did go ahead, and I'm very grateful to our partners, and our new partner, Berkhamsted School, who really supported us in both the Aim Higher events that took place during Easter, which was an online event, and the actual events. You will see the first photograph there is at Berkhamsted School, and it's to a credit, actually, that we will be doing that again this year, because it was very successful, not least because the feedback from young people was really very good. And actually, some of those groups have continued to meet on a Monday evening after school, where they receive tuition and wellbeing sessions from the virtual school. But also, by being local, it was cost saving, but also it enabled foster carers and social workers to either join the groups for the day or be part of the staff team putting on those events. So, and it was a really welcome interlude between lockdowns, actually. I'm going to run past this, but I would encourage everybody to look at this. It's only 30 seconds long, but it's a little masterpiece. So, but just to say that in the philosophy that I adopted, that this was business as usual, despite everything that was going on around us. We wouldn't get this time back for our young people, so we were determined to put the Hearts Awards on. And for those that haven't ever been to the Hearts Awards, watch this. There's a film embedded in this slide. Watch this. It will give you a taste of what it usually is like, the sort of joyful event it is. This year we filmed young people. We delivered their awards to their homes on their doorsteps, socially distant, and we were able to run that film. So we had the Hearts Awards at the right day, at the right time, broadcast to everybody who could get on the call. It was the most terrifying thing I've ever done, because the technology failed us at the very last moment, but the show did go on, thankfully. And we are hedging our bets this year. We are planning for an open air event, firework event, which will be filmed, so that no matter what happens, the 18th Hearts Awards will carry on this year. Development over time, as colleagues may know, that in 2018 the role of the virtual school was extended to include previously looked after children, and that has become more important over this period. What we have found, and I can honestly say the strategies we've put in place, I do believe have saved the breakdown of 2 adoptive placements, at least. We've got a very, very robust approach to this, and what we were able to do during the lockdown first time round was to open a helpline in April, because we were then, the development of virtual technology was really emerging. And since that's been improved, we've been able to be reintroduce the surgery, which carries on virtually so much as we are now today. But the helpline is always fully booked, and adoptive parents, special guardians are able to phone up an ex-head teacher who I commissioned to staff the helpline, and who's also an adoptive parent, to ask for advice and information, and they are directed and signposted to further help and support, or they will be invited to come to the surgery, which also is fully booked, and receive the benefit of being able to talk to an education advisor, a member of the adoption services support team, and be referred on should there be a further need. We have got a service level agreement with Adoption UK, who provide mental support for parents who are in crisis. Often their children, particularly during these circumstances, are finding education very difficult, they're very challenging children who are very challenged themselves. And I do believe we've been able to help and support parents very significantly through developing this work. Another aspect of the virtual school, we're now in our third year actually of working with children on children in need and child protection plans. And we are beginning to tease out what will really make a difference to the education of these children. DFE originally funded this work, and subsequently this has been supported by Matt Ansell for the third year. And this current academic year, opposed to what I'm reporting on in this annual report, we have included Year 7 students to see how the transition has been supported, because these children too are able to go into school. And I'm pleased to say that we are developing a system that is proving to be very helpful. We have a very comprehensive training program that we are just agreeing with social work leaders to support social workers in understanding how they can understand education and weave that into the planning for these children. What we know about this group of children from the DFE Children in Need research that was published in 2018, in June 2018, was that something like 69% of children on a child in need plan will escalate into care within 5 years. And this very small project, it's only with Year 6 and now with Year 7, is an attempt to find out what will help with the education of these children to provide additional protective factors to address that quite shocking statistic. I was asked recently by DFE to offer a report on the most updated information from this project, and was able to deliver that 2 weeks ago with a series of recommendations. We fully expect, and would have expected by now, actually, had the pandemic not happened, that DFE will make an announcement about possibly the virtual school having oversight of the education of these children in some way, yet to be determined. And so I hope in the next report that I'm able to give to you, we'll have more information about that. Further developments over the course of last year that will be rolled forward into this academic year. The Monday Club from Aim Higher. This is a group of Year 11 students meeting on a Monday evening and really guiding and supporting us in development of our plans on how to support them best. And from that and from other work that we are doing, I will be I'm putting into place now a COVID academic recovery programme that will include motivational sessions for key groups of young people, not just in Year 11, and also support for their learning and further development in education. MCR Pathways is a strategy that has been adopted by colleagues in Glasgow, where they have promoted a policy of inclusion, reducing exclusions to very, very few from a very high number over a period of 12 years. And I've been fortunate enough to have the Executive Director for Education for Glasgow come and speak at my conference, and she will be also addressing secondary head teachers next month, along with a head teacher from Glasgow who was an early adopter of the strategy, reducing exclusions in her school to a 0 over time and increasing outcomes for young people really significantly. MCR Pathways is a system of school-based mentoring and relationship-based support for very vulnerable children, not just children looked after, but about 80 young people in any 1,000 in a school. So children in the care system, children previously looked after, children on SIN and CP plans, children who are young carers. And it has got a really outstanding track record that I think would be very suited to Hertfordshire. I've got 5 secondary schools who have already expressed an interest, and I will be able to report on the development of that work next time. Bridge 2020 is a development of alternative and tailored education provision for those young people who will be resident in the newly created homes that the residential strategy is developing both for Hertfordshire and in conjunction with other companies who are setting up children's homes in the Hertfordshire region. And what we know is those children have very bespoke educational needs that needs a very considered response. So Bridge 2020 is an umbrella term for a series of alternative provisions that will be put into an education plan for each individual child as appropriate. It will include support of our education support centres, and each young person will be assessed for their specific needs. And we've had our first 2 young people start on that programme very recently. We have, through the developments of virtual technology, been able to update our self-evaluation form for schools. It's a Children Looked After self-evaluation form. It's a Hertfordshire Virtual School initiative, but what it does do, it supports schools to judge how they've implemented the statutory guidance associated with the education of children in the care system and how successful they are. It supports the school, particularly if they're preparing for an inspection, but what it also does, it encourages the information to be in one place and to be reported to the school governors, so they are fully aware of the developments of their school in relation to the children for whom the local authority is corporate parent. We contributed to the attachment Aware and Trauma Informed Toolkit. I'm pleased to say it's nearly 4,000 people in Hertfordshire, educationists in school in Hertfordshire, have received the information and training in the attachment toolkit, which is just a taster. However, it signposts colleagues to what can be achieved through understanding of the poor early start that some children receive in life and what it means for their education, and it signposts colleagues to where they can find out more and also how they can adopt a more inclusive culture within their school. During the first lockdown, we developed an asylum-seeking minors virtual school using virtual technology and individual teaching. We had 25 young people who either had no ESOL place, that's education as a second language place at college, or who preferred working in a group activity rather than home learning from the information supplied by their college. And we have picked that up again in this lockdown, and we've got a similar number attending. Also, we reviewed the offer for advice on careers advice and future prospects for our children, and what we have done is refined and developed the offer for those young people with special educational needs and disabilities, so that we are giving more time to support the transition planning for those young people as they leave school and become post-16, either going to college or entering the sixth form of their special school. There's more information on all of these aspects on the virtual school website, so this is just an aid memoir for that. And a brief update for this year, because I had been asked, and we are monitoring our attendance of children very closely. I produced a position statement that was given out to all social workers, schools and foster carers at the very beginning of this term, with the clarification that schools are not closed, but there is restricted access for eligible groups. So for the reasons I set out earlier, I'm very keen that children go into school where possible. We totally understand that some foster carers are extremely anxious about their children going in because of their children's health and because of their own in the family setting. And for that reason, foster carers having an opportunity to receive the vaccination as soon as possible is very welcome information. We can see that we got off to a good start this term with attendance, not as I would like it, but improving almost daily. Attendance has been quite difficult to gather because it's not a daily occurrence for all children, certainly not in the first lockdown and not now, because some young people are having a blended approach to their education, either in school with some home learning. We are putting the final aspects together for the Achievement Recovery Programme and using our pupil premium very strategically, working with partners to provide a series of motivational sessions. I'm looking to our colleagues in our private schools because they are doing something very similar, supporting young people to keep going, really, because a lot of young people are feeling very robbed by the fact that they don't have any end of key stage examinations to go in for. And we've yet to know what the consultation that DFE has conducted will come out with. But we are trying to support our young people to continue with their learning, but are fully aware that actually it's really very difficult for some foster carers whose children are at home. And we have got a lot of information and guidance and support on the website. And of course, the virtual school team is on hand to support individuals where necessary. So this was in essence the position statement that was delivered to everyone concerned earlier this term. And it has had a very positive impact, and we're working collaboratively with our social workers to support foster carers and indeed schools wherever possible. Now, this is very small, and I do understand that, but I hope you've had, I know you've had a copy of this, so hopefully you can expand upon it. We produced this for the first lockdown, and this is the most current version. Underneath the grey line of the months is business as usual, and colleagues can see what additional measures we've put into place to meet the challenges of the lockdown. And this is a one-stop shop for all the things that we've been able to achieve through the development of virtual technology. What I would say is I am extraordinarily pleased that by having briefings, conferences, and other training sessions online, we've been able to enjoy much greater numbers participating in that. And that is true for our young people as well. So when we've brought young people together for our interventions, we have had lots of young people, some of whom don't put their camera on, and that's perfectly all right, but they have participated in the chat. And so this is the benefit that I can see that has come out of the current circumstances. So just to end my presentation, I think I would like to say I'm happy to take any question that colleagues would like to ask. I hope that was clear enough, and I hope I didn't rush it too much, Chair. No, so I was conscious that I can always speak too long.
Thank you, Felicity. Could I ask you to turn your sound off, Felicity?
Oh yes, of course.
Just for a minute.
Yes, of course.
Sorry, there's some reverberation going on. Yeah, thank you for that. Some really exciting, obviously two parts of a year, but there's some really exciting developments which I really support, especially in relation to your ACE team, years 6 and 7. I think that's always really exciting, and I do talk about that at the OGA. Bridge 2020 looks exciting as well, especially for those children coming back. And I know colleagues are really concerned about the number of children who have to leave the county. So upping our game, as it were, for them when they come back, that's really going to be exciting as well. So thank you for that. Can I just ask, you have the support sessions for previously looked after children and their families. And that's also for families with SGOs. Do you remind SGOs frequently that there is that facility available? Because sometimes I hear they don't feel supported, but I think that's possibly a general thing, because this is relatively new, and I'm just making sure that everybody knows about it. And
I'll answer that. We attend the support groups for special guardians. But I would say that they are a harder group to engage than adoptive parents. If I were to run a conference for adoptive parents, I would have no trouble filling it, but we would have to work collaboratively with colleagues within the local authority to encourage special guardians to attend, a lot of whom, and it's significant actually for both of the parents, both adoptive parents and special guardians. The characteristic that I have noticed is they often leave problems a long time before asking for help. So we actively court that group, and by going to support groups, and of course working through our schools. The schools know who those parents are and often refer directly to the services that we have in place. It's not an equal balance, but it is a work in progress. It's about gaining confidence for those parents.
Yeah, I definitely support that, because many special guardians are grandparents, so they find it very hard, don't they? Okay, sorry for my cutting in there, guys. So can I go for ask Nigel first, please?
Yeah, thank you, Chair. And I won't go into too many detailed questions. I just wanted to thank Felicity again and all her staff for the work they've done in a very difficult year. And we talked about a year of two halves, but you've done very well. And again, and also the innovative ideas that again you've brought in, as you've mentioned, some of them mentioned you mentioned there, Teresa. Just to thank all the staff, and thanks for all your continued monitoring throughout the year. And I'm sure we'll, I will come back with other things maybe in the future, but I'll leave it at that. I know others may have more detailed questions, but thanks again to you and all your staff. Thank you.
Thanks, Nigel.
Thank you.
Mark.
Well, thank you, Terry, and thank you very much, Felicity. It's always extremely stimulating to hear you. You are such a full of ideas, and to see the journey you've been on over the years. And it's now becoming a much broader regime or approach to what might have been done previously. So thank you so much, and congratulations particularly for all the things you listed in Appendix 3, which you've introduced during the COVID lockdown. I found that an impressive list. I was just interested there's so many things I could ask questions about, but time doesn't allow. But the MCR Pathways scheme intrigued me, and I wondered if that fits in with the work that ESCs are doing. I mean, certainly, I know one very well. They do an awful lot of work going out to schools to get in there, to pre-intervene before children do get excluded. So are you sort of working that approach with the ESCs as well? Are they sort of in tune with what you're trying to achieve in that area?
MCR Pathways is a bit unique in as much as it's school-based intervention. I've consulted with everyone I can think of to try and introduce this into Hertfordshire. And indeed, on the 1st of March, we've got a briefing, especially for secondary schools. And Ian McRitchie, who is the instigator of MCR Pathways, Maureen McKenna, who is the Executive Education Director for Glasgow, and a head teacher, Joanne Sturgeon, from Drumchapel High School, will all be addressing that particular briefing. How it works is the school have what they call a Pathways Coordinator, so it's a member of school staff who will see the transition of those identified vulnerable children from primary into secondary, and will have meetings, both group and individual, for years 7 and 8. And then in years 9, 10 and 11, there is, through the MCR Pathways organisation, mentors that support each individual child, and one mentor, one child. So it's a very complex and quite wide-ranging enterprise. The outcomes are outstanding, and it's been researched by 3 different universities as a way of working with vulnerable young people. And what is very interesting is the mentors, for argument's sake, from the business school that looked at this work, achieve as much gain as the young people do. So there are a lot of willing organisations to support this work. Indeed, Maureen McKenna is a mentor in Glasgow for a child. And so we will be looking to gather mentors. I've got 5 schools that are interested already, and so I will be looking for a pilot. In answer to your question, Mark, I will want to dovetail all of this work with everything that's existing, because every little helps. And but I really think this will have tremendous outcomes, because what I've got an eye to is, if the DFE do broaden my role, not my role, but the virtual school role, to include children on SIN and CP plans, this will be the one way that we can really address that in all schools. So that's where I think it really will fit for Hertfordshire. Of course, nobody else is doing this. It just so happened, in those old days when we could go out, I was coming back from the theatre in London, and there was an article about this work in the Metro that I read, and the rest is history. So I've invited this into Hertfordshire. But I really think it's a good fit for us, and what might lie ahead for us, for our vulnerable children in the future. I hope that answers your question.
Yes, it does. Very well. Thank you.
Sorry, I'm not. My sound's not on, is it? Sorry, I do apologise. Lynn, sorry.
Thank you, Chair, but I think Jenny wanted to come in on the end of Felicity's conversation.
I think that's at the end of the discussion, I think, Jenny's.
Okay.
We'll go through it all first.
Yes.
Jenny. Yeah.
Yes.
Okay,
Okay.
thanks, Lynn.
Well, I think you'd be disappointed if you mentioned special guardians and I didn't come in on something. So
I set it up for you, Lynn.
I'm thinking about young people of a certain age who are going into school, and we do use the words and we know what we mean, that they're either key worker children or they're vulnerable children, and children hate labels. And I wondered if we can actually push to get special guardians and foster carers classed as key workers, rather than the children being vulnerable. And I think that'd be a much more positive role for the children, because it's not always how they feel with their peers. But you've heard parents at the school gates, and, you know, I just think there's something about, we need to big up the role of the foster carers, so the children aren't feeling wherever they go, they're only going because they have a label of being vulnerable. That's one thought. I saw an ex-colleague of mine on the news the other day pushing on Sky, I think, pushing for foster carers and special guardians to be pushed up the vaccination list. And I think you mentioned something, Felicity. So can you confirm that that's actually happened? And finally, when you mentioned about special guardians, they've never ever, and I was involved with the legislation oodles of years ago. So for 20 years, I worked with these kids and families. They've never felt in the same bracket as adoptive parents or foster carers. And I wondered, have you worked at all on any of this with Family Rights Group, who are probably the lead agency in the country, who have been, we work together on the legislation, who are probably the best ones and have such supportive bits, and that might help you get into the special guardians. Thank you very much.
Okay, Felicity.
Thank you, Lynn. For start, I could not agree with you more about the label that children don't like. In fact, every year we have what's called the Bright Spot survey conducted by Quorum Voice, and that's something that in the children in the care system, any child doesn't like to be put into a group, and I totally understand that. And it is something that is in our training for designated teachers, because quite a long time ago, thankfully it is a long time ago, that children were taken out of their lessons to go to their personal education planning meeting, and of course all the other children would say, where are you going? Or somebody would announce at the classroom door, your social worker's here. That, I'm grateful to say, is in the past, and we are working very hard for colleagues to see children first rather than what they come from. That's why I'm really pushing this relationship-based working, because it is about the quality of the relationship and understanding who that child is and what they could be, rather than what they, you know, what's down on the register. So I couldn't agree with you more. Jenny might want to say something about the vaccination programme, but I understand that our foster carers are at the top of the queue at the moment. So I couldn't be more pleased about that. And Family Rights Group, thank you very much for that information. I'll work with Adoption UK, although the name belies it should be for adopters only. They will offer this mentoring support to special guardians too. That is in our service level agreement, and have done. So there is some track record of that, but I will go away and maybe I may need some of your support, I don't know, but I will talk to colleagues at the Family Rights Group to see if we can emulate something that we already have with Adoption UK with them as well. So thank you for that.
Okay, thank you. Graham.
Yeah, Felicity, like previous speakers, thank you for all the hard work that you and your staff do. And I think we've got to remind ourselves that you face the same challenges. You know, you may have an illness in the family, you're working from home, you're homeschooling, etc., etc. And you really make a big contribution to the education for our children. Moving forward, I think you've got one of the biggest challenges that you've ever confronted. So the education gap doesn't actually widen. And I think that's going to be a really big challenge for you and your team and how you're going to do it. I know the government's mentioned they're going to throw some resources at it, but we don't really know what that is until that actually happens. So I do wish you well in the following year and your staff. And yeah, it was more a comment than anything else. Thank you.
Thank you. Well, I actually think that our children looked after probably have more attention than children who have parents at home at the moment. So, but anyway, it feels like it. I don't know. Felicity, you're.
I was just going to say that we, as I mentioned, we've got quite a detailed academic recovery programme that we're working on, and I'm going to be repurposing some of my staff to really focus on key groups within the care system, as well as all children, obviously, but key groups with motivational sessions and with additional teaching. Until I know what is the outcome of the consultation about what will happen at the end of the academic year in terms of assessment or examinations, we may even, and I can't promise this, but we may even have our own kind of assessment processes that we could reflect back into the Hearts Awards for children, because it's so important for young people to think they're working towards something. And so I couldn't agree more, Graham, that we have a really huge challenge ahead. All the research that's been published recently has said that the gains we've made over the last 10 years have been eroded by lockdown. Now, because we in Hertfordshire have been really pushing for children to attend school, and for one of the things that we've done this term is not only to monitor attendance, but we've been pushing to monitor engagement in home learning for those children that aren't attending. And I've been working with schools to ask them, what feedback are you giving our young people? Because some schools are commenting on the work that's been submitted daily, some are doing that weekly, some not at all. So we're trying to get a standard there, because young people need to know that they're working towards something, somebody's appreciating what they're doing and how they can progress. So we're trying to keep everything rolling forward, but it is going to be difficult. And I can't deny that. So, but we can do what we will do our very best. That's all I can promise.
Yeah, thank you. I know you'll do your best, Felicity, and as will the whole service in trying to help all young people. So, Jenny, do you want to come in finally?
Yes, thank you, Terry. Yeah, I just really wanted to say that this report, probably more than any of the other over the years, Felicity, just shows how much the virtual school model and what you and the team have developed not only is benefiting children in care, but also a broader group of children now. You've spoken about the projects around children in need and those who have child protection plans, and that learning we're broadening out. So I just think, you know, that all that the virtual school has achieved, but some exciting times ahead, despite the challenges we've got because of the impact of the pandemic on children's education. And just finally to say, picking up Terry on what you were saying, that this isn't just the virtual school. We absolutely promote a whole service approach here. And as you can see from the report, the virtual school does a lot of training, particularly of social workers, because education is at the core of the children we work with in terms of their outcomes. So just a big thank you, Felicity, and to the rest of the team.
Yeah.
Thanks.
Did I have a final word?
Well, I don't know. It's chair's privilege, but I'll let you say something first.
Well, I was just going to say, I've noted it in the report, the cross-service collaboration has been an absolutely outstanding feature of this period. So just to echo what Jenny said, I just think working together with colleagues from adoption, social care, health, schools has, because of virtual technology, has been so much easier. So I'm lucky enough to give you this report, but you know, I'm here as a figurehead, and it's everybody else's work. So you know, thank you for everybody really.
Yeah, can I just say finally, thank you very much, Felicity. Truly is what's been going on in our virtual school is truly inspirational, and the way it's connecting with other parts of the service as well. So I'm really grateful for that. And I'm sure that the model that we have at the moment, i.e. working with partners and using technology to work with our children, will be part of the good things going forward into the future. So thank you very much for that. So colleagues, can we all indicate our agreement that we've noted, commented, please? Okay, thank you very much, colleagues. Thank you, Felicity. So we'll now move on to our final item, which is Adoption and Children Act regulations. And Matt Ansell, Operations Director for Children and Families, will speak to us. So hi, Matt, are you there? Yes, I can see your picture.
Good morning, everybody. I'm just going to very briefly talk through the contents of this report. And as Chair has mentioned, this is around the Adoption and Children Act regulations and the amendments that were brought into place at the beginning of the pandemic. So in April 2020, 6 broad areas of amendments were brought into place. Those were reviewed in September, the 25th September, and 3 main areas were taken forward, and they remain in place and again will be reviewed at the end of March. And the current areas around the amendments are around visiting to children and young people, changing the rules around health assessments and the process of approving adopters, and the Ofsted inspection regulation and how that's happened. It's not happening at the moment, how it will happen going forward. So they were the 3 areas that have continued to be the amendments that are currently in place. And as it says in the report, broadly, Hertfordshire haven't had to use any of those amendments significantly in any way, but I will just talk through some of the things that we have been doing to provide reassurance. So as the report outlines, one of the key things we did back at the beginning of the pandemic was create a set of practice guidance related to COVID-19. And this set out a way of working for all of our staff to make sure that children remained safe and that we were still seeing children, that we were meeting our statutory obligations, but also we were also making sure that we were using the public health guidance around supporting our staff when they were visiting families in the community. And what we've done is we've reviewed those practice guidance on a fortnightly basis. So as we moved out of lockdown back in sort of July, August time, they were changed slightly, and then obviously when the second lockdown happened, we reviewed them, and again in January we have reviewed them. Hopefully what members can see from the report, where it outlines in detail what our current expectations are around visiting children. So we are still maintaining our statutory responsibilities in terms of face-to-face visits to children. We are combining that, and to our care leavers, we're combining that with the use of virtual technology. So social workers, as Felicity was just talking to, have found that actually the use of virtual technology to conduct child in need meetings or core group meetings when children are on child protection plans have really benefited actually. And we've been able to sort of really enhance membership at those meetings from across the partnerships, because people have found it easier to attend virtually. And we've also seen we've had some interesting feedback from our engagement with children and young people about how they've sort of found the virtual visiting of social workers sometimes easier, particularly in our residential settings. So I think moving forward, when we move out of a lockdown, we intend to fully combine the two. We will maintain our statutory responsibilities in terms of ensuring that we see children face to face, but we will combine that and use what we've learned during this period from children and young people's voice, but also what our partners have been telling us and what social workers and their team managers have been telling us. The report sort of goes on and it outlines in detail again around how we're conducting our assessments, how we've conducted child protection investigations, and how we've been conducting sort of child protection conferences. So the conferences have remained virtual throughout this time. As I've just mentioned, this sort of engagement in those conferences have always been positive, but we've actually seen GPs, for example, have been able to attend a lot easier. There's many aspects of the way we've been working that we will take forward into sort of the new ways of working. Colleagues have talked quite a lot this morning about children EHCP plans. Just to say that, again, statutory duties have been maintained, the reviews have been maintained, and there's been some sort of flexibilities around sort of tailoring those to individual needs. But as an overall, we've been able to maintain that part of our work. And in terms of the adoption and fostering processes, we've, again, like our child protection panels, our adoption panel went virtual. We've been able to maintain that. It's remained corporate, and we've been able to sort of maintain the sort of flow of approvals through that. What has been a challenge is around the medicals. So obviously GP availability hasn't been possible. So we do have some delays in those medicals, which we're sort of in the process of working through at the moment. But other than that, we've been able to maintain our sort of our arrangements around the adoption part of the service that we deliver. So that's, I guess, a brief overview of what the report was going to provide to the panel today. I'm happy to take any questions about any of that.
Thank you very much, Matt. Can I just start by asking you to take back to your teams our thanks for their sterling work over all the lockdowns, because I think it's been a challenge, and I think the latest one is one of the biggest challenges, actually. I think everybody's coming to the end, and I'm so grateful that there is, with the vaccine, there's an end in sight, and a new world starting up in the not too distant future, I hope. So can you take my thanks back, and I'm sure all members' thanks. So really, really grateful. And actually to hear you say that GPs are participating in assessments, that is really music to my ears. So that's certainly something good that's come out of COVID, and hopefully we can take that going forward, because that's been our big struggle in the past. So that's really, really good. So thank you. So I have Nigel, then Anthony, please.
Thank you, Chair, and thanks for Matt's report. Yeah, obviously I originally called for a briefing on this, and I think you might be going to do one anyway, especially after hearing the Children's Commissioner's concerns and obviously the Association of British Social Workers concerns. So, you know, I could see that overall there hadn't been the same effect, or that from your monitoring in Hertfordshire, but it was certainly, I think, right to raise it when you hear those two, you know, express concerns. And obviously, I'm pleased to see at 4.14 what's coming, and also the 4 points at 4.15, 4.15. Although I'm still a bit worried about 4.7. I don't know if you've got the paper there. But overall, yeah, I'm pleased that the effect on Hertfordshire and the monitoring that officers have carried out, especially after September. Thank you.
Thank you. Matt, can you comment?
I mean, yeah. I mean, no doubt that the pandemic and the lockdowns has created isolation for vulnerable families. So much of our work is relationship based. Much of our work relies on finding within families what support exists. So obviously, when that's restricted, as we have to at the moment, that does create added layers of complexity with our work because we can't rely on that in the same way. So that, you know, there has been a range of challenges to sort of our delivery of services, and obviously there's a range of community resources, volunteer services that haven't been able to operate in the same way. What we have done as the sort of local authority has had a regular operational meeting with key partners to keep oversight of our work. To make sure that we're talking to all of our key partners on a regular basis, understanding what pressures they're under, and making sure that we're all keeping to our statutory responsibilities. And I think that's, I think everybody knows it's a real strength of Hertfordshire, the partnerships that we have, and there's a significant commitment to safeguarding children and seeing that as a partnership response. So, yeah, no doubt our colleagues in health are under massive pressures, but they have maintained their safeguarding teams and have committed to continuing their safeguarding teams and being part of those plans that exist around children. Obviously, it's been touched on in Felicity's report. One of our key elements in our work with children and young people is, you know, they're in school, and school provides a place of nurture, support, social interaction and education for children. And therefore, that's why, you know, we've worked so hard with our school colleagues, with children and their families, to identify children, to support them to go into school during this time, and those children that aren't going into school amongst that vulnerable cohort, to make sure that we've got a really clear plan around how we're seeing them and visiting them. So I think what I would say is that the commitment of our social work teams and the wider professional groups has maintained and been exemplary, really, and has not wavered throughout this time.
Thank you. Just to add there, the Safeguarding Board are keeping a really strong eye on this one, and as you're aware, we do have the neglect campaign. Shall I call it a campaign? Sort of starting up in the county, so hopefully this will enable more people to understand what they can do to recognise, spot the signs, and give us that additional support within the community. So yeah, it's a challenge, but I think we just got to be vigilant and keep our eye on that. Did you want to say anything else, Matt?
Yes. Sorry, Chair. The one thing I wanted to also mention is that we're just about to have a peer review from colleagues in Cornwall. So we're virtually going to do a visit down there and look at how they've responded to the COVID crisis and the pandemic, how they've maintained services, how their leadership's been, and then colleagues from Cornwall will come to us on the 8th, so next week, for a couple of days virtually again. So again, that will provide levels of reassurance. It's something that we're really engaged with and find really useful, that peer-to-peer learning, and will provide us with reassurance and maybe some areas of recommendation from an outside view as well.
Yeah, that's excellent, really. So we're never shy of looking at best practice. So I think colleagues can be assured that we will do our utmost to make sure we're up there in the top, as it were. A shame it's a virtual trip to Cornwall, isn't it? And not an actual one, but anyway. Anthony. Do you want to type your question, Anthony, if your sound's gone down? Okay, well, I have to. He's going to type. Go. Okay, type. Just wait a moment. Just wait a moment while Anthony types in his question. Okay, Mark, a brief comment while Anthony's typing.
It was just to thank Matt and how encouraged I was that the county is not just taking the minimum allowable, but really looking to make sure that they keep the contact going through this very difficult time. And indeed, there's always something positive to come out, even the worst things. And what I was going to say was the fact that in the future we will use virtual technology in a positive way to help maintain those close contacts with all those children and families. So thank you very much, Matt. Keep up the good work. And I see now that Anthony has finished, so I'll step off.
Okay, thank you. This is Anthony's asking about how much of a problem is the GPs being diverted, Matt.
So one of the things linked to that is that the delays in also court final hearings. So we've had through that initial lockdown period, final hearings for children weren't necessarily being heard, which meant that the adoption approval at final hearing wasn't flowing through the system as well. We're starting to move forward with that, which is positive. In terms of the medicals themselves, I don't have the exact detail. I can find that out for you and give that to you at a later stage. But what I am aware of from talking to the colleagues in the adoption service is that during that sort of first period, right the way through to sort of September, October, there was obviously that those medicals weren't happening because GPs had to be diverted into other areas. My understanding is that, as it says in the report, that work is starting to flow through and we're starting to see some of those medicals happening, but I can get the exact data for you.
And there's also the question from Anthony, membership levels being restored to normal. I'm assuming that is the intention, isn't it?
Yes.
Yeah, absolutely. Okay, thank you, Anthony. Lynn, your quick question.
Thank you, Chair. Yeah, I just wondered, we used to say that children didn't like looking for help or support online because they didn't like their families or foster families seeing what their history was. How are we making sure that with speaking to young people remotely, we are hearing their voice and they haven't got someone in the background who's monitoring what they say? Thank you.
So I guess there's a number of safeguards around that. So I think as the report outlines, we're still maintaining face-to-face visits to our statutory responsibilities. So the virtual is an add-on in terms of our face-to-face work. So what a lot of the social work teams are doing is that some of that preparation and planning that would perhaps take place in the family home with visits and discussions happen virtually. The work, the actual individual work and sort of those opportunities to talk to children and young people on their own has sort of been the main reason why we still visit. So our visits when they're face to face have been a lot shorter, because we're just focusing on talking to the child and young person, and some of our interventions that we provide to families, particularly around our family safeguarding model, we've been providing virtually to the parents. So I think that's the main part of it. And then the other thing that I know social workers are doing, because they've talked to me about it, is that the children and young people, when they are talking to them virtually, will sort of show them around their bedroom with their phones and things like that. So, you know, the social workers are really aware of the importance of seeing and talking to children on their own, and you know, are committed to making sure that continues.
Okay, thanks very much, Matt. So thank you for that. That's always a useful reminder to us what we're actually achieving in Hertfordshire. So thank you for that. So colleagues, the panel is asked to note and comment upon the current practice within children's services as outlined within this report, with reference to the continued adherence to statutory responsibilities. So I think we've heard that and we've had a good conversation. So can we note and agree? Thank you very much. Okay, so I think we're there on that one. Yeah, thank you very much indeed. So colleagues, that brings us to the end of our agenda. I haven't been notified of any other business, so I thank you for your participation today. I think it's been a really full agenda and a really good conversation, as I hope you always feel you get at this panel. Can I just remind you that we have a members event at 2 o'clock today, talking about where officers are showcasing to us the fostering strategy. So that's from 2 o'clock to 3 o'clock. You should all have the links in your diaries, and this is open to all elected members. And that request came out of this panel, so I hope you are able to attend. Our next meeting is on the 15th of March, and that's going to be, well, at 10 o'clock or on the rising of the joint panel. So the joint panel will start at 9:30, and then this panel will take part at the end of that, hopefully at 10 o'clock. I've probably confused you, but anyway, there will be an agenda coming out in good time. So thank you very much indeed. I hope you have a good rest of the day, and thank you very much to all officers who have spoken to us today. So thank you very much. Thank you. Bye-bye.
Bye all. Thank you.
Bye.
Bye everyone.
Goodbye. Thank you.
Really interesting. Bye. Thank you. Thanks, Chair.